Hello everyone, this is Dr. Nerd, and today I'm gonna talk about the first pathology lecture, and which is the cell adaptation. First of all, I will talk about what is cell adaptation. Then I'm gonna talk about uh, what are the types of cell adaptation, and finally we will know about each type of it separately. So first of all, we have to know some basic principles about our body, which is our body is always in the hemostasis situation unless there is a change occurred on it. And what do I mean by hemostasis? Hemostasis means the balance. The balance. So our body is always in the balance situation unless we have a changes occur on it. And what are these changes? These changes are any increase or decrease in the stress of the cell. This will lead to change. Uh, this will lead to cell adaptation. So, firstly, we will talk about what will happen after we increase the stress on the cell, and we will have two things that will happen after we having so. First, first one is the hypertrophy, which means increasing the size of the cell, and secondly, we will have something called hyperplasia, which means we will increase the number of cells. So hypertrophy, as I said before, it means increase the size of the cell. We increase the size of the cell after we do three different things, which is firstly gene activation, secondly we increase the protein synthesis, and thirdly we will increase the production of organelles. Hyperplasia, it means we will produce more of a new cells after we stimulate the stem cells. So these two, which are the hypertrophy and hyperplasia, occur together in all tissues except the permanent tissue. And one example of that is the uterus during the pregnancy. Uterus during pregnancy always become thick and thicker to be a great receptor for the zygote and provide it or give it the environment that the zygote needs. As I said before, the exception is the permanent tissue. They can only go hypertrophy. They cannot go and do the hyperplasia because they have a selective number of cells and they cannot make a new cells. And the permanent tissue means or permanent cells are three types of cells: the skeletal muscle, smooth muscle, and neurons. And we will talk about them in the upcoming lectures. So, hyperplasia can lead to a cancer. After we increase the stress on the cell for a long time, we will have hyperplasia. After that, if we have the hyperplasia for a long time, this will lead to dysplasia. Sorry, dysplasia will lead to cancer. And one example of that is the endometrial hyperplasia. But we also have an exception for this rule, which is the prostatic hyperplasia. Prostatic hyperplasia cannot lead to cancer, so they only can go under the hyperplasia, but it cannot lead to cancer. It's impossible. And this is a picture which shows the what happened in the cardiac muscle after we increase the stress. As we see here, that the left ventricle cells are too much thicker than the right ventricle, and it can lead to failure, to cardiac failure, as we know. Uh, okay, so now we're gonna talk about what will happen if we decrease the stress on the cell. If we decrease the stress on the cell, we will lead to or two things will happen which will lead to decrease the size of the organ. These two things are decreasing the size of the cell and decreasing the number of cells. Decreasing the number of cells will occur due to apoptosis, and we all know as a medical student what does apoptosis mean. Uh, but for recapping, I'm gonna tell you, apoptosis means that the programmed death of the cell, which means the cell will commit a suicide and will die by itself. Also, the decreasing the size of cells uh, will occur due to ubiquitin protease degradation. This degradation for ubiquitin and protease will lead to or will tag the intermediate filament and cytoskeleton, which will uh, destroy, which will get destroyed, and then the size of the cell will get will shrink. The cell will shrink. After we talked about what will happen if we increase and decrease the stress on the cell, we will talk about now what will happen if we change the stress. Changing the stress on the cell will lead to changing the cell type, and it usually occurs on the epithelium. And the most common example is the Barrett's esophagus. So what happens in the Barrett's esophagus? As we know that in the esophagus, uh, the epithelium is stratified squamous epithelium, and in the stomach we have simple columnar epithelium. So the simple columnar epithelium is used to accommodate the acids. So when the stomach split the acid out to the esophagus, it will damage the cell or the epithelium of the esophagus, which will lead to reprogramming the stem cells in the esophagus, and it will become from stratified squamous epithelium to simple columnar epithelium. And we have Barrett esophagus. We took it in the GI block, which is called the GERD. It will lead to GERD, which is a type of cancer. It will lead to cancer, of course. So, as I said before, what happens in metaplasia is reprogramming the stem cell, but don't get panicked. It's reversible. If we increase the stress, or if we change the stress and put it back as it was, it will lead, or the stem cells will get reprogrammed again to produce the normal cell. So the metaplasia can become dysplasia, and then it will become to a cancer. Also we have an exception here, which is the apocrine metaplasia, which is what happens in the breast when during pregnancy or during giving a child, the stem cells will get changed to produce or to be able to produce milk. So after we talked about metaplasia and we know about it, we will talk about examples of metaplasia other than the Barrett esophagus. When someone has a vitamin A deficiency, this will lead to changing in the stem cell, or reprogramming in the stem cell of the eye. Normally, the eye's epithelium are the simple squamous non-keratinized epithelium. So when someone has acute vitamin A deficiency, this will lead to changing in the stem cell of the eye, and it will produce stratified squamous keratinized epithelium. Previously, we don't have, or in the normal situation, we don't have keratinized. It is non-keratinized. So when it becomes keratinized, so it will become the patient's eye, the epithelium of the patient in his eye will be the same as his skin. So this will lead to blindness. Also, when someone has broke his bone, sometimes the cells of the bone will go inside the muscle, and will will grow inside the muscle. And as we see here, we in the x-ray we will have extra muscle extra bone here inside the muscle, and this is called myositis ossificans syndrome, and it can be surgically uh, treated. And now we will talk about something called dysplasia. Dysplasia means a disorder in the cell growth. It is mainly refers to an increase in the precancerous cell. For example, something called CIN, cervical intraepithelial neoplasia. Neoplasia we will talk about it in the upcoming lectures. Don't focus on it now. So it rises from having hyperplasia or metaplasia and dysplasia for a long time. Metaplasia, as we said, in the Barrett esophagus syndrome, and the hyperplasia. Sorry, it is hyperplasia, not dysplasia. It's hyperplasia. Hyperplasia, like what happens in the endometrial hyperplasia. So this one is hyperplasia. It's not dysplasia, and it's reversible unless it become a cancer. After it becomes a cancer, it will become irreversible. So last thing we'll talk about is the aplasia and hypoplasia. So aplasia is a combination of two words. The first one is A, which means no. Plasia means production of cells. So when we add them together, aplasia means no production of a cell. So the real definition is failure of production of cells during the embryogenesis. And the most common example in this or on aplasia is unilateral renal agenesis. And that's all what you need to know about the aplasia. Hypoplasia means hypo means less, so decrease the cell production during embryogenesis, and this will lead to smaller organ because we produce less number of cells, and this will lead to less number of cells. This will lead to smaller size of organ. And the most common example of that is the Turner syndrome, and you can Google it and see how the organs in Turner syndrome's patients are really small. So that's all about the cell adaptation. Hope you get the benefit from that.